Hello everyone. So sorry for little delay. Today we'll be starting. See, Neet PG is coming. What all we can do in this minimal time is keeping a check on our all the PYQs. ठीक है तो सिर्फ PYQs नहीं पढ़ने. We have what is our aim is that whatever related information we can collect from that PYQ that we will do. इतना टाइम नहीं है कि हम बैठ के वी आर स्टार्टिंग फॉर वन year question we are taking 2 to 3 hours itna nahi hai but yes we have to limit ourselves but also we have to cover as much as possible but also we have to ठीक है चलो starting with today we'll study NEET 2023 okay so this is NEET 2023 recall that we will study and the related questions ठीक है starting with a lady with necrotic lesion on cervix is diagnosed with cancer cervix it was seen to involve the lateral pelvic wall what will be her treatment so हमें हमेशा what have we have been studying up till now is देखो सिल स्टेज 1 से लेके स्टेज 2A1 तक हमें पता है कि we do surgery ठीक है various kinds of surgery in different stages cancer cervix का treatment is most complicated लेकिन from 2A2 the cancer is so advanced that after that we do only the chemoradiotherapy that we already know अब अगर हम इसमें ये कैलकुलेट करने लग जाएं दैट व्हाट इज द स्टेज एंड देन व्हाट विल बी द ट्रीटमेंट इट विल बिकम लिटिल कॉम्प्लिकेटेड सो देर आर टू वेज either you remember the stage and then you remember the stage wise treatment this is one way another way is that you always remember whenever lesion is more than 4 centimeter anywhere in the cervix or out of cervix in or out of cervix it doesn't matter if it is lesion is more than 4 centimeter the answer is always chemo radio so if the question give you lesion which is more than 4 centimeter don't think where it is chemo radio similarly as soon as the lesion is out of upper vagina जैसे ही लेजन इज आउट ऑफ अपर वजाइना देन जैसे ही वो लोअर वजाइना में या पेल्विक वॉल में पहुंचता है अगेन द आंसर इज कीमो रेडियो therapy so as the lesion is out of upper vagina and obviously the parametrium because cervix के आसपास upper vagina and parametrium are very close by so unless it is there okay but as it goes into the lower vagina and the pelvic wall and anywhere the now you can't do the surgery now it is inoperable what you have to do is only and only chemotherapy so this is one way of remembering the treatment another way of remembering the treatment is stage wise you always remember cancer cervix ke treatment is various kind of surgeries now surgeries can be fertility preserving ठीक है fertility preserving surgeries होती हैं and somebody who doesn't want to preserve fertility non-fertility preserving ठीक है so these two kind of surgeries we can do in every stage starting with minimal stage 1A1 when the lesion is less than 3 mm 1A1 fertility preserving surgery here is always conization just remove a cone of cervix simple somebody does not want to preserve fertility simple hysterectomy if she does not want to preserve it then answer will be simple hysterectomy 1A1 की beyond आप जाते हो यानी कि from 1A2 till again 1B1 from 1A2 till 1B1 I can still do fertility preserving surgery but now it is modified trachelectomy now I can't do only conization trachelectomy where along with cervix I remove some of the vagina and paravaginal tissue that is the uterus preserving surgery if someone does not want to preserve uterus I can't do simple hysterectomy what I have to do is modified radical hysterectomy also called as type 2 hysterectomy modified radical from 1B2 till 2A1 ठीक है why 2A1 because 2A1 के beyond after 2A2 now surgery can't be done so till 1B2 से लेके 2A1 I can't do any uterine preserving surgery uterus can't be preserved now only thing I can do is uterus removing surgery and here I have to do a radical hysterectomy means remove as much tissue as I can radical hysterectomy also called as type 3 so this is how the treatment of cervical cancer is done This is the time to remember again, revise the types of hysterectomy. Type 1 is simple hysterectomy. We remove only the uterus, bilateral tubes, and ovaries if needed. So, simple hysterectomy is type 1. Type 2 is modified radical. Type 3 is radical. Type 2 is modified radical, also known by name of Verdheim's hysterectomy. Whereas radical is called as Meig's hysterectomy. Meig. डिफरेंस क्या है डिफरेंस चार चीज़ों में आता है बिटवीन रैडिकल एंड मॉडिफाइड रैडिकल द डिफरेंस इज इन फोर थिंग्स फर्स्ट इज डिसेक्शन ऑफ यूट्राइन आर्टरी remember in a modified radical you try to resect as less as possible so in modified radical you resect uterine artery at the crossing of ureter whereas in radical you dissect uterine artery jahan pe wo originate hue hai at its origin. Then the ligaments, the uterosacral and Macken-Rod ligaments are cut at origin in radical. In modified radical, you try to restrict yourself. So you cut them at their midpoint. Difference number two. Difference number three is between the vesico-uterine ligament. The anterior vesico-uterine ligament is cut, whereas the posterior uterine ligament is preserved in case of modified radical hysterectomy, whereas it is cut, both of these are cut in radical. Fourth is the vaginal cuff. A small vaginal cuff is removed in modified radical, whereas in radical, upper two-third is removed. So these are the four difference point between radical and modified radical. Extended radical मतलब उससे भी ज़्यादा. Along with uterus, ligaments, uterine artery and origin, along with that, you are removing some of the periureteral tissue, you are removing some of the parts of the bladder and some of the parts of the rectum. ठीक है? Question. So this was all information that was important in relation to first question. Question 2. Mother of a 14-year-old girl underwent surgery for cancer cervix. What should be done in her daughter? So क्या करेंगे daughter में? Should we check her, do her cervical biopsy? She might also suffer from cancer cervix. These are the risk factor of cancer cervix. Remember, risk factors of cancer cervix are more of a behavioral cancer. It is not a genetic cancer, it is because of the behavior. Anybody having high risk sexual behavior will have higher chances of HPV and will have higher chances of cancer cervix. So, generally, genetic is not a risk. A mother having cancer cervix doesn't mean daughter will also have it. The risk factors for cancer cervix is young age at intercourse, multiparity, multiple sexual partners, smoking, HIV, lower socioeconomic status. They are all the cancer cervix risk. So in this girl, as such, mother having cancer doesn't mean she also will have cancer. So what we will do? Vaccination. Not because her mother has cancer, because vaccination is universal. It has to be done in everyone. That is why. BRCA testing is done for ovarian cancer. We are not going to do that. P10 mutation is the mutation which is done for advanced stages of endometrial cancer. So what we are going to do here is HPV vaccination. Let's see the vaccination guidelines. The vaccination has to be done ideally at 11 to 12 years. This is ideal. What is the starting stage? You can start it as early as 9 years. So 9 years पे start कर सकते हैं up till 26 years. What is the vaccination schedule? From 9 years to 14 years, as per Indian guidelines, you give 2 doses, 6 months apart. From 14 years till 26 years, you give 3 doses. WHO की SAGE guideline देखें तो because उस पे question आया है WHO की SAGE guideline is different. It is also called as a low dose guideline. ये कहती है that from 9 to 20 years, 1 or 2 doses sufficient, no problem. From more than 20 years, 2 doses. That's what it says. ठीक है 3 doses तो उसने लिखा ही नहीं. So this is what it is. Genetic ovarian risk, we know genetic ovarian risk is because of it is genetic. Ovarian cancer runs in the genes, it runs in the family. So hold on, my T was here. So genes responsible for ovarian cancer is BRCA gene, breast cancer gene. It has an autosomal dominant inheritance. What is recommendation? Anybody having BRCA gene? Anybody having BRCA gene positive? How does it work? First, anybody having high BRCA gene positive should undergo oophorectomy. Ideally, and that oophorectomy should be done within 35 years of age. But if someone has not completed her family, meanwhile, you will advise her OCPs. So OCPs will be advised till she completes her family, and after, once she completes her family, oophorectomy has to be done in everybody. Okay, management. Next, what is meant by neoadjuvant? So NEET 2023 में there were a lot of questions on gynae. Lot of questions came from gynae, which is very different from what is routine. Op से ज़्यादा question आते हैं, but there were a lot of questions from gynae, especially cancers and operative. ठीक है? What is meant by neoadjuvant chemo? See, chemotherapy, gynecological, which cancer में chemotherapy is the treatment? Ovarian cancer. Ovarian cancer is the one where chemo is the main treatment. See, treatment of ovarian cancer is basically it is, अगर मैं इधर लिखूं chemotherapy. But you know, when there is big cancerous tissue, there are a lot of cancerous cell. Chemo will not act. If there is a big cancer sitting in your abdomen, chemotherapy will not act. So before chemotherapy, what you have to do is debulking surgery. Debulking surgery is done where as much suspicious tissue as possible is removed. Why it is done? So that chemotherapy cells can act. And chemotherapy is basically platinum based chemotherapy that is used. Okay? But what is neoadjuvant? Sometimes the cancer is so advanced. In advanced stages, sometimes it is so advanced that it becomes unresectable. I can't resect it. So what do? We give chemotherapy prior to surgery, which is not a routine, but we give 3 cycles of chemotherapy prior to surgery, result in shrinkage of the tumor mass. Now I do surgery. Surgery to karni hi padegi. And then I give remaining chemotherapy. So this chemotherapy, which is given before the surgery, is called as neoadjuvant chemotherapy. What is neoadjuvant chemo? Chemotherapy started before the surgery to decrease this extensive lesion. Obviously done in advanced cancers. Okay? What is true about trichomonas? Okay. Trichomonas is a sexually transmitted infection. We have read it in vulvovaginitis. हो सकता है हमें कुछ चीज़ें इसमें नहीं पता. ठीक है, हमें जो आंसर है वो हमें नहीं मालूम. आई डोंट नो वेदर इट कैन बी कल्चर्ड और नॉट. आई नेवर फोकस्ड ऑन इट. जब मैंने पढ़ा तो मैंने ध्यान नहीं दिया इट कैन बी कल्चर्ड और नॉट. कोई बात नहीं. डू आई नो इट सेक्सुअली ट्रांसमिटेड? यस, आई नो दिस. डू आई नो ऑन वेट स्मेयर आई कैन सी ट्राइकोमोनास मोटाइल ऑर्गेनिजम्स? यस. Under urine microscopy, can I see the twitching mobility? Yes, I know this. They are mobile, flagellated. So my answer is this. Maybe while reading, I missed it. Many times it happens. I missed whether it can be cultured or not. Don't lose hope. Read other 3 options. This I have read. So I know it cannot be cultured. It's not true. It can be cultured. There are very few bacteria that cannot be cultured. Why they cannot be cultured? Because there are certain fastidious organisms which need such a good culture media and nutrition that you cannot culture them. So there are few bacteria which can't be cultured. One very commonly used in gynecology, your Treponema pallidum. It cannot be cultured. Other than that, Mycobacterium leprae. Other than that, Vibrio cholerae. Either cannot be cultured or their culture is difficult. Then, yeah, that's it. Corynebacterium diphtheriae. These are the organisms which are difficult to culture and cannot be cultured. Okay? Trichomonas can be cultured. It's a sexually transmitted infection, and in microscopy I can very well see it moving with a twitching mobility, and that is how I differentiate it from leukocytes. बहुत बिल्कुल अगर आप सैंपल लोगे ना, ट्राइकोमोनास लुक एग्जैक्टली लाइक ल्यूकोसाइट्स, सेम साइज होता है. ओनली थिंग इज दे आर फ्लैजुलेटेड सो दे कैन मूव. Okay. चलो. A lady presented with a vaginal discharge. On examination, she has cervical erosion. What kit has to be given? Now be very focused. Vaginal discharge की kit तो green होती है, तो चलो it means it is green. Vaginal discharge की नहीं, vaginitis की kit green होती है. Discharge due to vaginitis is green. She came to you with vaginal discharge. She doesn't know it is cervix or vagina, where the discharge is coming from. Now it is written there is a cervical erosion. So this discharge is basically cervicitis. It is cervicitis. The kit of cervicitis, cervical discharge, is gray. Okay, so don't just see the options and jump onto it. If they mentioned cervical erosion, there is a reason. So this vaginitis discharge coming from vagina is green kit, whereas discharge coming from cervix is gray kit. Let's see how to remember the kits. See, reproductive tract infection की दो approaches होते हैं. One is etiological approach. Make the etiology. जो हम पढ़ते आ रहे हैं clinically, microscopically see the candida, microscopically see the trichomonas and make the etiology and then treat. It is then in developed countries where there is microscope in every lab. They need do nucleic acid amplification also. In India, in developing countries like ours, we don't have even the microscope in our labs. There we do syndromic approach. Means treatment based on the symptoms. I don't want to know the causative organism. Whatever symptoms you have, I will give you antibiotics of all the probable microorganisms causing that symptom. Vaginitis है, मुझे पता है vaginitis is because of 3 organisms: trichomonas, bacterial vaginosis and candida. So I have made a kit which contains antibiotics for all 3 of them. Cervicitis है, I know cervicitis is because of 2 organisms: Neisseria gonorrhea and chlamydia. I will not make etiology what is the cause. I have made a kit containing antibiotics for both of them. इसी कहते हैं syndromic approach. This is syndromic approach, where the antibiotics are given based on symptoms. Very well, it does very well, very cost effective in a country like us. So that is how government NACO guidelines have made these colored kits based on the symptoms. See, vaginal discharge, vaginitis. So green kit is for vaginitis. It is not just for vaginal discharge. Vaginal discharge coming from cervix is gray kit. How to remember? Vaginitis, one of the very common organism is trichomonas, which is green in color. So, green kit. Because of trichomonas, remember, vaginitis is green kit. Okay? Now comes ulcers, herpetic ulcers. Herpetic ulcers are extremely painful, very painful. They are red, painful. So, red kit. Herpetic ulcers, red kit. Obviously, what will it contain? I know, acyclovir. ठीक है, non-herpetic ulcers. So you have seen ulcers in mouth, they are white. So non-herpetic ulcers are white kit, non-herpetic ulcers. Now comes abdominal pain. Abdominal pain in a sexually transmitted infection is mostly due to PID. So दर्द से लाल पीला होना, यही this is how we describe दर्द से लाल पीला होना. लाल is done, yellow kit for abdominal pain, lower abdominal pain, most likely PID, yellow kit. ठीक है. B for buboes, B for black kit. So inguinal buboes means inguinal lymph nodes, black kit. Some people, so see non-herpetic genital ulcers, one of the very common cause of non-herpetic genital ulcers is penicillin. ठीक है, syphilis होता है ना most common cause, so we give penicillin. Some people are penicillin resistant. So when they're penicillin resistant, somebody who can't use a pen, I give blue color. Somebody can't use pencil, sorry, penicillin resistance. So remember, this person can't use a pencil. So I will give a blue pen, blue kit. Blue kit for somebody who is penicillin resistant. This person has a non-herpetic ulcer and is also penicillin resistant. I will give blue kit. Rest all discharge. Cervical discharge, rectal discharge, urethral discharge. It's like a huge mammoth in the room. जो भी discharge है, cervical, rectal, urethral, gray kit. So this is how you can remember various kits. ठीक है, चलो. Next question. A lady with multiple partners present with perineal ulcer. ठीक है, ulcer पे है, painless. ठीक है, and inguinal lymph node which is also painless. What is the diagnosis? Syphilis. See, it is very easy. Whenever you see genital ulcer, always see whether this ulcer is painful or whether this ulcer is painless. Painful ulcers are only two: herpes and chancroid. Inguinal lymph nodes in both of them are painful. Remember, inguinal lymph nodes will be painful in both of them. How to differentiate? Herpes are multiple clear punched out ulcers, multiple small punched out ulcers, whereas chancroid is one or two, one ulcer or two ulcer, one or two deep, dirty, indurated base, this kind of ulcer. Okay? Painless ulcer is three. Painless ulcer, painless lymph node. Lymph nodes are also painless. So everything is good. That is why patients generally don't even come for treatment. Syphilis. Painless ulcer, no lymph node. Lymph node है ही नहीं. Granuloma inguinale. What granuloma inguinale has is, what actually granuloma inguinale has is skin induration at inguinal area that looks like lymph nodes, but it is not. So granuloma inguinale mein there are skin induration which look like lymph nodes. So we call them pseudobulbos. Painless ulcer. Ulcer is painless, but lymph nodes are very painful. Patient comes only when lymph nodes develop. Very painful. Lymphogranuloma venerum. Very painful lymph nodes producing a groove sign in the inguinal area. So always remember, painless ulcer are only painful ulcer are only two, herpes and chancroid, whereas painless ulcer, notice the lymph nodes first. Okay? A patient with multiple sexual partner present with swelling and difficulty in walking. What is this? So can you see this swelling coming from labia minora in posterior one third? So in posterior one third at the vaginal introitus is what? Bartholin gland. It's a Bartholin abscess where the treatment will be antibiotics plus marsupialization. Where we marsupialization में we make a cut and evert the margins. Margins को ऐसे evert कर देते. That is marsupialization. A patient presented with vaginal discharge. A patient present with vaginal discharge which eventually stopped. ठीक है, discharge था वो stop हो गया. Now she has pain, intermenstrual bleeding and dysuria. What is her diagnosis? Infections के बाद pain होने लगा. Any sexually active women with pain abdomen जिसमें there is no other system look involved, जिसमें लगता है कोई और system involved नहीं है, no other system look involved, and there is tenderness on examination, इसमें नहीं दिया है, that is a case of PID. So any sexually active woman comes with pain abdomen, they have a history, it was a vaginal discharge prior to it, it is PID. Remember, PID is caused by two sexually transmitted infections. More common one, chlamydia. Another is Neisseria gonorrhea. They are the two most common agents causing PID. So gonorrhea. Trichomonas or candida ऊपर cervix तक नहीं जाते. They don't affect the columnar epithelium. They don't cause PID. They cause only vaginitis. ये सिर्फ squamous epithelium को affect करते हैं. Columnar epithelium को chlamydia and gonorrhea affect करते हैं. Syphilis is not a cause of PID, it is a cause of vulval ulcers. Okay? A patient undergoing hysteroscopy was seen to have 2-liter fluid deficit. Fluid deficit मतलब हम fluid अंदर डालते हैं. Uterus is a collapsed cavity. When we do hysteroscopy, we have to open the uterus by injecting the fluid. We have to keep a count of this fluid because some of the fluid will be absorbed through uterine surface, some of the fluid will be absorbed obviously. So we make a fluid chart. How much fluid is being inserted, how much fluid is regurgitating out. If there is a deficit of 2 liters, means this 2 liter has gone where? Patient has absorbed this much. This much fluid has absorbed. What will happen? Pulmonary edema. This is the first thing that happens, pulmonary edema. Then next second thing that can happen is CHF, congestive heart failure. So see, डिस्टेंशन मीडियाज फॉर हिस्ट्रोस्कोपी आर बेसिकली 2 to 3 टाइप्स. पहले, बहुत पहले गैशियस डिस्टेंशन मीडिया होते थे, वेर यू यूज टू इंसर्ट गैस, बट उसमें आप ऑपरेट नहीं कर सकते थे, दे वर ओनली डायग्नोस्टिक. नाउ रिमूव्ड. देन केम लिक्विड मीडिया. पहले आए कुछ हाई मॉलिकुलर वेट मीडिया विच वॉज डेक्स्ट्रॉन. नाउ व्हाट वी यूज इज लो मॉलिकुलर weight medias, which are molecular weight very less. Safest distension media is normal saline, very safe. It is electrolyte rich and chances of less edema. Edema chances, absorption chances are less. But what was the problem with normal saline is we can't use monopolar cautery in normal saline. We can't use monopolar. Then came electrolyte poor media, glycine, sorbitol, mannitol. Ye can be used in monopolar. But the problem is ये इतने hypoosmotic हैं, इनके electrolytes are so less, they are very rapidly absorbed, very rapidly. ठीक है? So whenever normal saline you are using and the fluid deficit is more than 2.5 liter, you have to stop the procedure. At 2.5 liter fluid deficit, stop the procedure. Whereas in these electrolyte poor medias, since they are very fastly absorbed, you have to stop the procedure when the deficit is 1 liter. Or old age may you have to stop when the deficit is 700 ml. So this is the time where you have to stop the procedure in case of hysteroscopy. What will happen? Pulmonary edema, cerebral edema, and CHF. Okay. A patient is posted for hysteroscopy. What procedure can be done? Hysteroscopy is a very good instrument used for all the intrauterine pathologies. Hysteroscope is an instrument inserted inside the uterine cavity. So anything which is intrauterine has to be done hysteroscopically. Tubal ligation, यहाँ पे ट्यूब्स को बांधना, cannot be done hysteroscopically. Subserous myomectomy can't be done. Cervical polypectomy, वो cervix बाहर दिख रहा है आपको, hysteroscope क्यों चाहिए? Cervical polypectomy can be done directly without hysteroscopy. Hysteroscopy is for uterus. Polyp here, yes, that is a procedure that can be done hysteroscopically. Polypectomy. Other than that, कोई सबम्यूकोजल मायोमेक्टमी कर सकते हैं. ठीक है, ट्यूबल कैथेटराइजेशन करते हैं, ट्यूब्स जो ट्यूब्स हैं उनके अंदर हमें कैथेटर इंसर्ट करना है, ये कर सकते हैं, नॉट ट्यूबल लाइगेशन. अ पेशेंट एडवाइज फॉर लैप्रोस्कोपी ओवर ओपन सर्जरी. आजकल हर सर्जरी को लैप्रोस्कोपिकली किया जाता है. क्यों? Because the incision you made on abdomen on open surgery is huge, which cause a lot of bleeding, discomfort, delayed recovery. Laparoscopy में you use holes to go inside the abdomen. अंदर कुछ भी कर रहे हो, but because abdominal incisions are small, it is less painful. Recovery is fast and blood loss is also less. Only problem is if some injury happens, it is very difficult to locate. Because using a microscope, if a ball injury happens, that will be lost in the bowel. You can't locate it now. Open surgery, mein everything is open. You can easily locate. It is difficult to detect any injury via laparoscopy. Be it ureteric injury, be it bowel injury. A 23-year-old patient brought by her mother-in-law. After 6 months of marriage, as she is not able to conceive, she is menstruating regularly, her BMI is 22. What is next step? What is the definition of infertility? No conception for 1 year. She has come only after 6 months. Reassure her. But remember, she is 23. If the age would have been 35 years and more, you have to evaluate after 6 months. So this duration reduces to 6 months in case the woman is 35 and more. Since she is young, we will send her back. Okay. A patient is being given HMG, human menopausal gonadotropin. Basically, gonadotropin is there for IVF. Ultrasound shows this. What is this? Very easy. आपने इतना ज़्यादा दे दिया है gonadotropins that her ovaries are overstimulated. ठीक है? They are overstimulated, resulting in something called as OHSS. जब भी हमने gonadotropins पढ़ा है, we have read 2 very common complications: multiple pregnancy and overstimulated ovaries. Ovarian hyperstimulation syndrome. Why it is not PCOS? This is PCOS. Small cyst at the periphery. This is PCOS. These are huge cysts in the ovary, OHSS. Dermoid cyst looks like this. Dermoid cyst is not fluid filled cyst. They are more of a, what do we say? They are more of ground glass appearance. So dermoid cyst has more of a ground glass appearance. ये थीका ल्यूटिन सिस्ट क्यों नहीं है? थीका ल्यूटिन सिस्ट मिलती है हमें मोलार में. थीका ल्यूटिन सिस्ट looks exactly same. Exactly same. How to differentiate? By history. If they would have given a history of molar pregnancy, तब ये आंसर थीका ल्यूटिन सिस्ट हो जाता. They have given history of IVF, that is why it is OHSS. Image देखिए, you can't differentiate. Okay. A patient of primary amenorrhea. Again, what is the definition of primary amenorrhea? A woman, no menses, no secondary sexual character even after age of 13. A woman has secondary sexual characters but no menses after age of 15. That is primary amenorrhea. ठीक है. On PR, okay, she has cyclical pain and suprapubic lump. जैसे ही हमने ये पढ़ा, हमें पता है it is a case of cryptomenorrhea. But it is nothing special because सारी options cause cryptomenorrhea. On PR, per rectal examination, there was fullness in whole vaginal length. What is fullness? Why is fullness? Most likely there is blood in whole of the vagina. That is why it is full. Okay? So how does cryptomenorrhea present? Cyclical pain, very typical. Cyclical pain and suprapubic lump, क्योंकि uterus is filled with blood. Now they have said that जब आपने PR किया, even the vagina is filled with blood. तभी तो PR में there is fullness. You did the PR, there was fullness. Which pathology will lead to fullness in or blood being filled in vagina? अगर cervical agenesis है, cervical agenesis, and no doubt blood will fill in uterus, but it will not come in vagina. Upper vaginal septum, vagina will be empty. Vaginal agenesis, vagina बना ही नहीं है. How will it fill with how will it be filled with blood? Only pathology in which vagina will be filled with blood is hymen is imperforate. यहाँ पे imperforate hymen. Imperforate hymen is a pathology where vagina is filled with blood. ठीक है. A girl of primary amenorrhea with no breast. ठीक है. Primary amenorrhea, no breast, no pubic and axillary hair, bilateral inguinal masses. ठीक है. No breast, no pubic axillary hair and bilateral inguinal masses on ultrasound. Uterus, no uterus, vagina and ovaries. कुछ भी नहीं है. What is her diagnosis? So since we know Turner syndrome में there is no breast, correct, but there is streak ovaries. There is, isn't it? And also uterus and vagina are present. PCOS तो definitely नहीं है. PCOS तो secondary amenorrhea करता है where the patient has breast. Now the question is between this and this. Many people say, so now I don't know what examiner was actually thinking while giving such a complicated question. दो तरीके हो सकते हैं. Maybe this was a misprint. ठीक है. And also in androgen insensitivity there is breast development present, but it comes late. It doesn't come as the puberty starts. It comes late. Androgen insensitivity presents exactly like that. ना ही uterus, ना ही vagina, ना ही ovaries, inguinal masses. This inguinal mass, जब भी inguinal masses लिखा है, testis की ही बात हो रही है. Ovaries are never inguinal. So inguinal mass means testis. So सब कुछ, no breast, no pubic axillary hair, everything looks like complete androgen insensitivity except breast development. So generally breast development पहली बात androgen insensitivity में बहुत immature होती है. It is not a fully mature breast, it's an immature breast. But yes, it is there. Another probable diagnosis that can be there is hypergonadotropic hypergonadism, in which there is a rare enzyme deficiency, which is 17 alpha hydroxylase. Whenever there is 17 alpha hydroxylase deficiency in a male, what will happen? Since it's a male, so there will be testis. But what will happen because of 17 alpha hydroxylase deficiencies? Androgens, this male will not form androgens at all. Because of this enzyme resistance, there will be no androgen formation. As a result, there will be external genitalia will like be that of a female, and there will be no breast, there will be no pubic and axillary hair. कोई एंड्रोजन है ही नहीं, ना ही टेस्टिस एंड्रोजन बना पा रहा है, ना ही एड्रिनल ग्लैंड. ठीक है, बट टेस्टिस एंटी मुलेरिन हार्मोन बना रहा है. टेस्टिस इज मेकिंग एंटी मुलेरिन हार्मोन, जिसकी वजह से यूट्रस वजाइना भी नहीं है. So very complicated. It can be hypergonadotropic hypogonadism because in this syndrome, a rare enzyme deficiency presents like this, where there is no androgen in the body. No androgen in the body means no pubic axillary hair, no breast also. Breast क्यों बनती है एंड्रोजन इंसेंसिटिविटी में? क्योंकि जो एंड्रोजन होता है उसकी बॉडी में एंड्रोजन होता है, इट इज अ रिसेप्टर डिफेक्ट. जो एंड्रोजन होता है वो पेरिफ्री में जाके ईस्ट्रोन बनाता है. But in 17 alpha hydroxylase, there is absolutely no androgen. That is why there is no breast, no pubic and axillary hair. If I would have been at your place, I would have marked complete androgen insensitivity, thinking that it is a printing mistake. Simple. ठीक है, तो अगर एग्जामिनर को रेयर एंजाइम डेफिशिएंसी देनी होती तो वो रेयर एंजाइम डेफिशिएंसी देता, वो 17 अल्फा हाइड्रोक्साइलेज डेफिशिएंसी देता, वो उसको हाइपर गोनाडोट्रोपिक हाइपोगोनाडिज्म नहीं देता, which is the main category जिसके अंडर ये फॉल करता है. तो very unlikely that this is the answer, in my opinion. A 35 week pregnant woman, ठीक है, चलो, a 35 week pregnant woman has delivered twins. How much is the time? Okay. Last time उसने last time twins deliver किए थे, इस बार वो फिर से pregnant है. So this is her second pregnancy. और last time para होता है how many times your pregnancy has crossed the viability. ठीक है, how many fetuses you have नहीं, how many times your pregnancy has crossed the viability. She's para 1. ठीक है, बिकॉज उसके ट्विंस ने एक बार वो प्रेगनेंसी ने वायबिलिटी क्रॉस किया था. सो शी इज पैरा 1. Okay. A patient 32 weeks pregnant present with over distended abdomen, not tense. Not tense मतलब abruption नहीं है. Fetal parts are not easily felt. समझ में आ गया हमें क्या है? It is a case of polyhydramnios. Abruption में tense होता, woody tense. IUGR में it is not over distended, it is smaller, so it is polyhydramnios. Polyhydramnios मतलब 3 definitions याद रखना है. AFI more than 25, ठीक है, single deepest pocket more than 8 centimeter, या फिर total fluid, जो कि ये definition नहीं है but फिर भी total fluid more than 2 liter. That is polyhydramnios, or also called as hydramnios. What is the cause? See, oligohydramnios का cause होता है generally congenital anomalies like renal anomalies. बच्चा यूरिन नहीं बना पा रहा. But polyhydramnios का cause होता है congenital anomalies of GI tract. बच्चा उस fluid को absorb नहीं कर पा रहा है, like tracheoesophageal fistula, cleft lip and cleft palate. But baby is not able to absorb. Musculoskeletal defect, जिसकी वजह से there is no absorption. ठीक है, ईसोफेजियल अट्रेजिया, जब भी बच्चे का एब्जॉर्प्शन खराब होगा, नहीं कर पाएगा, देयर विल बी एक्सेसिव फ्लूइड. ठीक है, दीज कंजेनाइटल अनोमलीज. बट यू नो व्हाट इज द मोस्ट कॉमन कॉज? इडियोपैथिक. दैट इज द मोस्ट कॉमन कॉज. अदर कॉजेज ऑफ पॉलीहाइड्रोमनोसिस, जब बच्चा बहुत ज्यादा यूरिन प्रोड्यूस कर रहा है. ओनली रीनल अनोमली दैट विल प्रेजेंट विद पॉलीहाइड्रोमनोसिस. तो जनरली रीनल अनोमलीज में ओलाइगोहाइड्रोमनोसिस होता है. बार्टर सिंड्रोम, where the baby produces more urine. Other than that, diabetic mother, जब भी mother diabetic है, baby will also increase the urine production. So diabetic mother. ठीक है, so these are the causes of polyhydramnios. Definition याद हो गई हमें? Okay, causes समझ आ गए. Complications क्या हो सकती है polyhydramnios में? There can be abruption. इतना ज़्यादा fluid है, if that fluid leaks, it can lead to abruption. It can lead to preterm labor. ठीक है, it can lead to dystocia, difficult labor. It can lead to PPH. How to treat? पहली बात, you have to treat only when the mother is in distress. If it is severe, then only mother has respiratory problem, she has a problem in her daily life, then only you manage, otherwise you don't have to. Okay? And the management is amniocentesis. You remove 1 to 2 liter of fluid in repeated sessions every 20 to 30 minutes. Her 20 to 30 minutes may you remove the fluid. Okay? That is the treatment of choice. Just give me a second, my battery is getting low. Let me see how much is left. Okay, we are very close to finishing it. Let me put a charger to it. Just give me a second. Just give me a second. Let me put a charger to it. Uh, I'm really sorry for the inconvenience. Suddenly my battery dropped, the laptop battery. Yes, here we go. So what we were discussing is that we do not need to treat an amniocentesis unless the patient is in distress, and the treatment of polyhydramnios is amniocentesis. Indomethacin, remember, is a drug that is used in polyhydramnios क्योंकि वो बच्चे का urine production decrease करता है. But nowadays it is said that indomethacin should not be used. If you want to use, क्योंकि indomethacin अगर आप use कर रहे हो, it can lead to something called as patent ductus arteriosus. ठीक है, एनएसएड्स यूज करने से पेटेंट डक्टस आर्टेरियोसिस हो सकता है. सो इट इज बेटर टू डू एमनियोसेंटेसिस ओनली व्हेन पेशेंट हैज सिम्टम्स. Okay, you can ask, it's a live session, you can ask me question whenever you want to. Okay, whenever you have a doubt, please let me know. A 36 weeks 6 days patient with a transverse line, everything is normal. What will be the next step? So she is not in labor. So whenever she is not in labor, transverse lie ho ya breach ho, you always try for external kyphlic version. External kyphlic version is done anywhere from 36 to 38 weeks prior to labor. She should not be in labor. Okay, so anybody who has no complications, you should always try for external kyphlic version, where you try to rotate the baby. What are the contraindications for external kyphlic version? Placental abruption, whenever the fetal heart is not doing good, there is preeclampsia, ruptured membranes. She is in labor, membranes is ruptured, there is bleeding, and some RH isoimmunization. Also, at many places it is written that previous LSCS. In these cases, you don't do external kyphlic version. And anything that contraindicate vaginal delivery. अगर आपको लगता है vaginal delivery नहीं कर सकते तो why will you rotate? नीचे कोई pelvic tumor है, why will you rotate? It will not come out. Pelvic contraction है, you will not rotate. So anything that contraindicates vaginal delivery contraindicates external kyphlic version. So here there was no contraindication, you will do ECV. ECV को हमेशा 36 weeks के बाद ही करते हैं. A patient of infertility of 3 years has 6 weeks amenorrhea, present with spotting. Adnexal mass मिलता है with fetal pulse. So क्या है ये? Ectopic pregnancy. क्या करेंगे इसमें? साइज, एचसीजी सब याद करने से अच्छा है पहले देखो, but cardiac activity present. So if the cardiac activity is present, no matter what is the size, no matter what's the ECG, cardiac activity present है, that baby is live. वो grow करेगा, it will rupture. So salpingectomy. Always self inject me if there is cardiac activity present. ठीक है. So what is the treatment for ectopic pregnancy? We know treatment for ectopic pregnancy can be conservative. ठीक है, but conservative के लिए beta HCG should be less than 1000. Sac size should be less than 3 centimeter and patient should be stable. मेथोट्रिक्सेट जो कि दी जाती है IM और सिंगल डोज. देखो मल्टी डोज दे सकते हैं बट इट इज नॉट नीडेड इन 90% पेशेंट. 90% पेशेंट आर इम्प्रोवाइज्ड बाय सिंगल डोज मेथोट्रिक्सेट. You don't have to give multi-dose. So single dose methotrexate is given if the sac size is more than 3 centimeter. Cardiac activity is, sorry, beta HCG is less than 5000. More than 1000 but less than 5000. ठीक है. अगर बीटा एसीजी ज्यादा है, सैक साइज ज्यादा है या कार्डियक एक्टिविटी प्रेजेंट है, देन योर आंसर विल बी सर्जरी ऑलवेज. ठीक है. लैप्रोस्कोपिक सैल्पिंजेक्टमी. Okay, please ask questions. If you will ask questions, you will learn better. A lady is in asthma, is in labor. What will not be used? We know asthma में हमेशा याद रखना है that what we cannot use is carboprost. Carboprost is not used in asthma. Ergot alkaloids are not used in asthma. What I can use in asthma is the safest is mesoprost and oxytocin. These are safest that can be used. So what will not be used? PGF2 alpha. ठीक है. A patient 34 weeks pregnant feel dizzy on lying and feel better on turning left side. Simple है. क्या हुआ है इसको? IVC compression. IVC compression की वजह से the return is impaired and as she turns onto left side her IVC compression is better. Obviously she feels better. ठीक है. Management based on a partogram. So exactly question was not with me but it was something related to partogram. देखो पार्टोग्राम ये जो है ना ओल्डर पार्टोग्राम है. अभी तक न्यू पार्टोग्राम पे देयर हैज बीन नो क्वेश्चन. ओल्ड पार्टोग्राम में ये समझना होता है कैसे मार्क करते हैं. रिमेंबर ओल्ड पार्टोग्राम दैट there are first is fetal heart rate. Fetal heart rate should always stay between 110 and 160. That should be the fetal heart rate. Plotted every hour. There are two lines, alert and action lines, separated by 4 hours. Your plot should always be on the alert line. हमेशा अपना पहला plot on the alert line करते हैं. वो 4 बजे आई है, her dilation was 6. My plot will be here. My partogram will start from here. Plotting will not be here. So plotting is on the alert line. In case it gets slow, every 4 hours I'll do the PV. In case it gets slow, it will cross the alert line. As it crosses the alert line, I will become alert. I will do certain interventions to see why it is slow. The rate should be 1 centimeter per hour, cervical dilatation rate. ठीक है. This is the contractions. Contractions, number of boxes. Number of boxes I am coloring shows the number of contractions in 10 minutes. Number of boxes I am coloring. If it is a dot, it is a bad contraction. If it is a line, bad means less than 20 seconds. If it's a line, it is a moderate contraction. But if it is I'm coloring it completely, it is a good contraction. ठीक है. A patient is in 2nd month of pregnancy with anemia, hemoglobin 9. When will you start iron? Remember, irrespective of the trimester, if she is anemic, I'll start the hemoglobin then and there. First trimester में आप oral iron आराम से दे सकते हो. You can't give IV iron, but you can definitely give oral iron. If she is severely anemic, आप blood transfusion दे देते हो, लेकिन first trimester में IV iron नहीं देते. So she is in 2nd month, most likely 8 weeks. I will start the iron from 8 weeks itself. देखो iron की ये prophylaxis and treatment guidelines आपको याद होनी चाहिए. If she is less than 34 weeks, she is mild or moderate anemia, I will treat using the tablets. But if she is more than 34 weeks, I will take IV iron because I don't have time. If she is severe anemia, then Less than 34 weeks पे I will give IV iron, but more than 34 weeks पे I have no time, she is severe anemia, I'll give blood transfusion. Less than 5, irrespective of gestation, I will give blood transfusion, otherwise she'll go into congestive heart failure. ठीक है, this is for the treatment. Prophylaxis of iron deficiency anemia क्या है? According to recent Anemia Mukt Bharat program, every woman is given 60 milligram iron tablet containing folic acid 500 mcg for 180 days. This is according to Anemia Mukt Bharat. 60 milligram elemental iron and 500 mcg folic acid for 180 days and 180 days again in postpartum. ठीक है. A patient delivered a baby at 31 weeks with rash and bilateral cataract. So remember this infections. ये बहुत important है. I'll tell you a very easy way. ठीक है. Whenever question gives you chorioretinitis, calcification and hydrocephalus, ये एक tried है. Chorioretinitis, calcification and hydrocephalus, very typical of toxoplasma. ठीक है. This is a triad present in toxoplasma. अगर हाइड्रोकिफिलस की जगह यही प्रेजेंटेशन में माइक्रोकिफिली दिया है, CMV. CMV में they will give you chorioretinitis, calcification and microcephaly. Along with that, CMV has sensory neural hearing defect and thrombocytopenic purpura. So thrombocytopenic purpura and sensory neural hearing defect is there in CMV. एक और इन्फेक्शन है जिसमें सेंसरी न्यूरल हियरिंग डिफेक्ट होता है और माइक्रोकिफली होती है. Microcephaly and SNHL, one more infection, rubella. But question will always mention, along with rubella, question will always give cataract and heart defect. So cataract and heart defect are also there, always there in rubella. ठीक है. Varicella question कैसे बताएगा? Cicatricial skin lesions. Cicatricial क्या चाहिए? इसमें ब्लैक कलर की पॉलिथीन के अंदर खोलो. ब्लैक कलर नहीं ड्रॉर पे ब्लैक कलर की पॉलिथीन है बेटा. Cerebral cortical atrophy, limb hypoplasia, chorioretinitis, all that is present in varicella. ठीक है. पारोवायरस में क्वेश्चन क्या देगा? अनीमिया, अबॉर्शन, अनीमिया, हाइड्रोप्स, दैट इज इन पारोवायरस. सिफिलिस में स्नफल्स, रैशेस, टेप्स डोर्सालिस, all that is present in syphilis. ठीक है, that's it. हाँ, तब से ये तो बोल रही हूँ. About infection, remember these things. Which infection is most teratogenic? Which infection has highest antenatal transmission? Rubella. So every woman has to be vaccinated for rubella. Everyone. Which infection has highest perinatal transmission? Perinatal मतलब around delivery. Which infection has highest perinatal transmission? Herpes and varicella. उसमें भी herpes has highest transmission. ये भी एक PYQ है. Herpes has highest perinatal transmission. ठीक है. Primary herpes is a contraindication for vaginal delivery because highest perinatal around delivery बहुत ज़्यादा transmission होता है. So it's a contraindication for vaginal delivery. अगर varicella हुआ है around delivery, you delay the delivery. जब तक वो varicella lesion ठीक नहीं हो जाता, you delay the delivery. ठीक है. So these are the infections with highest perinatal transmission. This is the infection with highest antenatal transmission. Toxoplasma and CMV has highest transmission in the third trimester. So transmission risk is highest, but anomaly risk is lowest in this time. ठीक है. Same. अब देखो, baby delivered preterm with rash, thrombocytopenia and hepatomegaly. Hearing test is failed. SNHL है उसको. With thrombocytopenic rash, it is CMV. Last question में क्या था? This was the last question. 31 weeks with rash with cataract. Cataract हमेशा rubella में होता है. So it is rubella. Okay. Last question. Which statement of the among the following is true? Is intestinal mucosa radio resistant? No, it is the most radio sensitive tissue. Effects of radio on normal tissue and cancer tissue is same. No, नॉर्मल टिश्यू डज नॉट रिस्पॉन्ड वेरी वेल टू कीमो, उन पे भी रेडियो का इफेक्ट आएगा, बट कैंसरस टिश्यू रिस्पॉन्ड वेरी वेल टू रेडियो बिकॉज उसमें डिवाइडिंग सेल्स होती है. Radiation dose received by a particular organ is indirectly proportional to the distance. This is true. Blood vessels are radio resistant? No, they are not radio resistant. So this is the true statement. So this finishes our NEET 2023. After a few days, we will cover NEET 2024. If you have any doubt, write down in the comments. Okay, so do write down in the comments if you have any kind of doubt, and slowly we will cover all the NEET questions and the related topics, and in the last we'll have a chanting session also. Take care. Bye bye.